So good afternoon, everybody. I'm absolutely delighted to be here to tell you a little bit about the patient voice in cancer research. To put things in context, in 2020, it is estimated that there will be 200,000 people living with a cancer diagnosis in Ireland. That's equivalent to 3 full Croke Park seated events. While this reflects that our treatments are getting better and patient survivorship is improving, we still have a long way to go. In hospitals, patients are treated by teams of doctors and healthcare professionals who all contribute as a team to look after our patients. Similarly, in cancer research, a team approach is vital, bringing researchers with different expertise and training to the cancer research dialogue. What is now imperative is that patients are embedded within these cancer research team discussions. Patients are unique consultants with a unique lived experience and a unique voice, which has to be central and contributory to our research, right through from having that initial eureka moment to ultimately making a significant impact on our patients' treatment and quality of life. The patient voice in cancer research is an initiative to bring patients and researchers together in this dialogue to ensure the voice is heard, listened to and acted upon. Since 2016, the patient voice in cancer research has had a number of workshops. For example, in April 2019, we worked with the National Cancer Registry of Ireland, who needed patient input to a questionnaire that will go out to 9,000 patients across the island of Ireland with a cancer diagnosis to clearly identify what the unmet clinical needs are for patients following diagnosis. Thanks to funding from the Mater Hospital Dublin and more recently from the Irish Cancer Society, we have been able to host these workshops around the country, which has been such amazing support for the patient voice. Last October, we were in Cork, and at the end of this month, we will be in Galway, the European Capital of Culture 2020, with a Dragon's Den themed workshop, where researchers will pitch to a panel of dragons, our patients, to seek their expert opinion and advice on how they can make their research more impactful, how they can involve patients more readily in their research, and how they can share their research with the wider community. We are currently looking for dragons in the Galway and wider Connacht area, and if you would like to get involved, please talk to myself or Barbara at our stand at the end of the hall. So on behalf of the Patient Voice in Cancer Research team, I would like to thank all of our wonderful patients who have been working so closely with our cancer researchers, and we are very excited to see where the rest of the journey takes us. So I would like to finish with a reflection from this amazing book by Charles McCann, many of you may already know of it, entitled The Boy, the Mole, the Fox and the Horse. These are 4 very different and incredible characters with weaknesses and strengths like all of us, who meet in a forest in springtime and they are trying to reach home. In the context of home, this is of course different for all of us. For a patient, it might be getting home, it might be completing treatment, or it might even be getting out and running again. For the researcher, home could be getting an amazing result from an experiment or know that their work has contributed to a new drug treatment for cancer. So I want you to picture the little boy and the mole sitting on the horse's back and the fox walking beside them as they make their way to the edge of the forest, where they see the amazing countryside ahead. "We have such a long way to go," sighed the boy. "Yes, but look how far we've come," said the horse.